time. So what does rhinoplasty mean? So rhinoplasty, essentially, the word rhino comes from the Greek word rhis, which means nose. Plasty means reconstruction, so rhinoplasty means reconstruction of the nose. It's the most searched aesthetic procedure on the internet. We get something like 96,000 people searching about rhinoplasty every month. So for that reason, it makes it very difficult to rank on Google for rhinoplasty. So in the UK, you get about 80% of those who have rhinoplasty in a year are female, 20% are male. But we're seeing increasingly more males having rhinoplasty. So the question arises, why do people have rhinoplasty? Essentially two reasons. They may not like the shape of their nose, so for aesthetic reasons, or they may have functional problems, so difficulties breathing, or it may be a combination of the two, so aesthetic appearance and functional problems. So you get patients coming forward wanting that to be corrected. So I'll talk in terms of what the patient needs to do. So how do you go about finding a rhinoplasty surgeon? I've produced some blog articles about vetting a plastic surgeon. I've also got some videos on YouTube. If you go on YouTube, just type my name, you'll see a series that I think we've got nearly 60 videos now. Some of the videos are on rhinoplasty, so you can easily, using the guidelines, you can find a good plastic surgeon. So maybe go online or speak to your GP or speak to friends. Go on the general medical website and look for the doctor's credentials. Make sure they're on the specialist register for either plastic surgery or ear, nose and throat. And then you can then check their resume. You go on their website, you can check their before and after photos. You can also check reviews. But I think speaking to the surgeon is very important, and then looking at their before and after photos. Now, let's say you've now decided you're going to have a rhinoplasty. You found a surgeon. How do you prepare for your consultation? All I say to my patients is you write everything down on a piece of paper, anything that troubles you or any questions that you may have. You go for your consultation, you spend some time with your surgeon, maybe half an hour to an hour, depending on what the surgeon will be doing during the consultation. Thank you, Francesca, for joining. Thank you. So, what kind of questions do you ask? So at the consultation, your surgeon will want to find out, your general health situation, previous surgeries, medications, allergies, your social history, essentially who's going to, I do my rhinoplasties as day case. I do them under general anesthesia. So it's very important for me to make sure that there's someone at home that will look after you after the procedure. Also in my practice, I know this is a bit controversial. I always, on all my rhinoplasty patients, carry out 3D analysis, and I've printed out some slides, and I'll just quickly go through what I do. I use a software called Vectra. In the past, when I did this talk, I think 18 months ago, I had a colleague of mine criticize me and say, not everybody has 3D analysis in their office, and I shouldn't be making it, talking about it as if it's the standard. Well, that's the way I do it, and it helps me a lot because by the time I go to do the surgery, I know exactly what I'll be doing. I'm not thinking in the operating room, I'm just performing because I've already planned everything out. So in the office, we'll take 2D pictures and 3D pictures, and then I'll spend about 45 minutes at home in the evening just going through the 3D pictures to analyze not just the nose but the face, because that's one of the biggest mistakes potentially somebody starting out doing rhinoplasties will do. They'll just look at the nose, but you need to make sure that the nose sits nicely on the face. So the 3D analysis allows me to analyze the face and the nose and to make sure that the final outcome is suitable for the face. So we start off by doing landmarking. So we look at the glabella, the radix, the inner and outer canthus, the alar base, the length of the upper lip, the proportion of the upper lip to the rest of the lower third of the face. So we get all those marked out, the subnasally, the commissures, the menton and the pogonium. And that allows us to then move on to looking at other aspects of the face. We also look at the symmetry of the face. So the face is split into two, and the left side is then doubled on itself, and the right side is then doubled on itself. And what you want to see is that the three images all look the same. Now, if there's discrepancies, if let's say the right side looks bigger than the left side, then you know that the face is asymmetrical. But I think in this particular patient, everything looks fairly similar. So she's got a very symmetrical face. Then we also looked at the face in proportions, upper third, middle third, lower third, and the profile. And there are certain ratios that I would need to see to make sure that everything falls in place. And then we also look at the vertical fits of the face. So you get lateral, right lateral, and then the orbits, the central portion, which looks at the nose, and then the right side and the lateral side, and then I also look at the alar base size. So in some patients, particularly patients of Afro-Caribbean origin, the alar base usually tends to be quite wide, so we look at doing alar base reduction. So these measurements allow me to determine that. And then we look at the projection of the nose. You want to see a ratio of about anywhere from 60 to 65%. Anything more than that, then you're thinking of reducing. Anything less than that, then you're thinking of increasing the projection of the nose. And then we look at the nasolabial angle. There's certain parameters for those. That's required, as well as the nasofrontal angle. And that just allows us to determine if we need to augment the radix. That's really important because particularly patients of ethnic origin, Afro-Caribbean origin, the origins of the nose, the radix can be quite low. So you augment it with either fat or cartilage. We look at other proportions. The nasomental angle is really important. You get patients who come for rhinoplasty and the chin is really small. The chin, you want to see an angle of about 130 degrees. If the chin sits quite back, then that can be quite reduced, in which case doing the nose alone may not be sufficient. You may need to augment the chin with either a chin implant or perform a genioplasty. I've had instances where patients have come to me and said, oh, they want a rhinoplasty. They think their nose is too big, but the problem is actually a very small chin. And then once you advance the chin, you find that the face falls into balance. The face is in harmony and you don't need to do a rhinoplasty. So it's really important to look at that as well. And obviously the facial angle, you want to see something around 165 degrees. And then where the nose sits, is the nose deviated or central or sitting right in the middle? This slide really shows, you see the nose is straight down the middle, so there's no deviation. It's zero. So that's important as well, because if the nose is deviated, then you may consider doing some osteotomies, which osteotomies means breaking the nasal bones, or doing a septoplasty to get the nose back to where it should be. And then the height of the nose, is the nose is it projected out the dorsum or is it sitting back? So this configuration allows you to determine that. So as you can see, there's good 13 slides there, so it's a lot of information, and I take great care to make sure that I've got everything noted down and just where it should be. And then you get the final slide, which gives you a summary of what you need to do. So in this patient, essentially the blue dots are where the patient requires an augmentation. The red dots are where the patient requires a reduction. And as you can see, once I've done all that, then I then do an output, which I send to the patient. And if the patient is then happy, and then that will be the plan. So you can see the pre-op, the nasal vault is quite wide. I'll just bring that close so you can see the nasal vault is really wide. And then after I've taken all the measurements into consideration and done what's required, you can see the nasal vault is smaller. So that really that tells me that I need to focus on narrowing the nasal vault. Also, we look at the right quarter view. So you have to look at the nose from various angles to make sure that everything sits quite nicely. So the right, so that's before and that's after. So this is before surgery. So, and I'm just trying to get the patient to, to be on the same, to be on the same page as the patient. Make sure that I understand exactly what the patient wants. Now, if the patient is not happy with this output, we can go back to the office, sit down and find out exactly what the patient wishes to have. So, that way, I can understand what's going on in the patient's mind. I just need to make sure that we're on the same page before we do the operation, because this way you avoid a lot of problems post-surgery. So that's the left quarter view. And then, the left profile view And then finally, the worm's view, which gives you a good indication of where the nose sits on the face. So you can see the patient had a broad tip, slightly broad tip. Post-op, you know, what we're planning to do, we narrowed the tip as well, in addition to narrowing the bony vote. So that's the way we plan the procedure. So once the patient is happy, we don't set a date. The patient then comes in. We send out instructions to the patient with consent forms and terms and conditions and aftercare documents to the patient. And then on the day of surgery, we usually try and start first thing in the morning. Usually we try and be in the operating room by 8:30 in the morning. It would take me anywhere from 90 minutes to 2 hours to do this. When I started out doing rhinoplasties, I was doing a lot of open rhinoplasties. Nowadays, I'm doing closed rhinoplasties. And the benefit of that, particularly in Afro-Caribbean patients, is you see less swelling. Swelling after rhinoplasty can take anywhere up to 18 months to settle down. So you do not get an immediate result. So patience is of essence. I say this to all the patients. Patience is absolutely of essence, because some people think, they've had the rhinoplasty, that's it. They want to, they're going to look like what they wanted to look like. No, you got to be patient. You just got to give it time. Usually about 3 months post-op, 90% of the swelling would have gone. And then I see them. So I see the patients at 1 week. Take out I used to use internal spleens. I don't use those anymore, because taking out those internal spleens, I found some patients find it extremely painful. So what we do is we just put in quilting sutures into the mucosa around the septum. And then if I've done osteotomy, so I'll put a tape and an external splint. So the patient comes back at 1 week and I take out the splint and the tapes. And then we give them some Baconase nasal spray. Baconase is an antihistamine. It helps to reduce, it also helps to soothe the inside of the nose and helps with all the swelling as well. So they start using Baconase, 2 drops in the morning, 2 drops in the evening in each nostril. They do that for a good 6 weeks. And I find that helps. Also, for those wearing glasses, I tell them not to wear glasses for 6 months, because in the past I've seen patients come back to clinic at 6 weeks who were wearing glasses with new bone formation, and it causes a lot of irregularities, and that's a bit of a problem. So I say to those who wear glasses, please try and get contact lenses and not wear glasses for 6 months. And that's really stopped the incidence of new bone formation. So they go home. I see them at 1 week, 6 weeks, 3 months, 6 months, and at 12 months. And if I was fine at 12 months, I then discharge them. With regards to, I've already mentioned that we do them as day case. So they make sure that they have a chaperone, somebody who picks them up from the hospital. Because in the UK, you can't send somebody home by themselves the same day after surgery, in a taxi. They have to go home with someone if they've had a general anesthetic. So that's regulation. So I make sure that they got a chaperone, they got someone to take them home, and they've also got someone to stay with them at home the day of the surgery. So I usually advise patients to take a week off work. Obviously, they'll have the splint on the nose for a week. I also advise them to use 2 or 3 pillows to prop their heads up. That helps with the swelling. There's controversy about using pineapple juice. There's literature suggesting that it does help with the swelling. So I would say to patients, get some pineapple from, places like Sainsbury's or Tesco's, or, have some pineapple, because apparently that tends to help. They go on with antibiotics for 5 days, broad spectrum antibiotics and painkillers. And then they get a whole document of what to do, what not to do, who to contact in case of an emergency or case of excessive bleeding, and then the next day I call them myself to make sure that all's going fine. So rhinoplasty of itself, what can go wrong? Pineapple, yes. Well, there's literature suggesting that it does help. It's got a chemical. The name escapes my mind at the moment. I'll look it up. There's a chemical in pineapple juice that helps, and I've read about it online, and there are publications about it. So yes, it does. I just can't remember the name of the publication, but I'll make sure I let you know. I can't remember the name of the chemical within pineapple juice, but I'll certainly come back to you about that. I'll have to look it up again. So where was I? So yes, so it's a surgical procedure. What can go wrong? So the thing that, things that can go wrong, common things, infection. I've never had anyone had infection following a rhinoplasty. It's quite rare because the face obviously is a very vascular structure, so it's unlikely that they get an infection, but infections can happen. Bleeding post-op, that's a worry. Scarring, particularly if you've done an open approach and you've used incisions along the columella or the incisions inside the nose. So those can thicken up and form unfavorable scars. Now, if that happens, what do? You can use silicone gels, or if they're very thick, you could do injections of Kenolog or Adcortib. Airway difficulties. Some patients may experience problems with breathing, particularly if you've done a structural approach where you've dismantled the structures within the middle vault and you've not used spreader grafts or turning grafts where the internal angle gets narrowed, then they may experience difficulty with breathing. Asymmetries, patients may get asymmetries of the nostril, particularly if you had to do some tip rhinoplasty. Thank you for all those joining. We've been going on now for nearly 20 minutes, but it's great people are joining. If you have any questions, by the way, please just ask and I'll answer. Another potential complication is dissatisfaction. What I do with those who may have a complaint is I just ask them to wait, because there is no point doing a revision before 12 months because the nose keeps changing, and what you don't want to do is do a revision procedure when the nose is changing. You need to wait till you get your final result, and then you correct whatever has gone, whatever is not right, rather than correct it when you've not got the final result. So I say to everyone, please, you just got to be patient. Be patient till we get to the 12-month mark so we can get your final result, and then we can go back to the drawing board. And then obviously revision rhinoplasty. My revision rate for rhinoplasty is somewhere between 2 to 3%. Yes, that's what I try and do. I've mentioned swelling previously at the start of the talk. So particularly those with thick skin, swelling can be a real problem. But you just got to reassure them and advise them to be patient. I'm not a big fan of using steroids to reduce swelling because it can cause, it's first of all, it's unpredictable, its actions. And then I've had cases where the patients have insisted on having steroids, and then I've injected, particularly Afro-Caribbean patients, injected steroids, and then you see maybe telangiectasia forming, or you get discoloration, so that you get white patches beginning to appear where you injected the nose. So I try not to do that. I just ask them to tape the nose. So swelling, if they have experiencing swelling, what I show them how to tape the nose. And essentially you get a little, maybe steri strip or a little tape across the middle vault of the nose. You do that at night time. And usually within 2 to 3 weeks, you'll see a difference. You just put a tape around the middle of the nose. Just keep it on during at night time. And you find that by 2 or 3 weeks time, the swelling has dramatically improved. It's a little trick, and you get a lot of swelling when you do an open rhinoplasty, because obviously you disrupt a lot of the lymphatics compared to when you do just a closed, where the lymphatics at the base of the columella is still intact. So that's one of the reasons why I've veered more to doing closed rhinoplasty rather than open rhinoplasty. So yes, so I think I've blabbed on for 22 minutes. God, time flies. Has anyone got any other questions? If you have, please just ask and I'll answer. I'll do my best to answer. If not, then we'll be having another talk in 4 weeks' time. We'll be talking about facelift surgery. At the moment, we're working really hard. We're updating all the content on the website. We're trying to rank very well on Google. I've actually taken on an SEO course again. So we're working really hard. We're bringing in some new services for the practice. We're working on migraine surgery. We're working on hair restoration surgery as well. We're working on some of our pages, such as the breast augmentation page. So we've got quite a few things we're doing right now, so that when the new year comes, we'll be in a good position in terms of ranking on Google. We're also getting some really good backlinks to the website to make the website rank well. So if you haven't got any questions, then I will call it a day. Thank you for everyone who's joined us this evening. Or if you want to DM me later on, if you think of anything else, please do. And I'll do my best to answer your questions. Okay then. Enjoy the rest of your Sunday and have a happy and successful week. Okay, till next time. Thank you.